Welcome back to Better Arizona. I'm Sarah Karlstrom. Today we're talking about ways to improve your appearance with minimally invasive surgery. I'm with Dr. Richard Fisher from Peoria Cosmetic Surgery. And doctor, when people think cosmetic surgery, we see all that stuff in Hollywood, we see how people look, and a lot of times it doesn't look good. Tell me the goal of cosmetic surgery.
Well, particularly with the face, you just want to turn back the clock a bit. We want to rejuvenate the face. We don't want to change the way you look. We want to make you look like you looked maybe 5, 10, 15 years ago.
So if someone looks at you, they don't know anything's wrong, they don't notice anything's been done, they just notice that you look good and refreshed.
That's right. If it's really well done, the cosmetic surgery, they don't know what you've had. They say, well, maybe you've had your hair done, you lost some weight. They really don't know what's been done.
Well, let's talk today about facelifts. And we've got Karen right here who had a facelift a couple months ago. What is a facelift?
A facelift addresses the lower part of the face, the neck, the jowls, the cheeks. It's designed to pull the neck back and pull the cheeks up. In Karen's case, she had minimal neck sagging, she had early jowling, and she had a little sagging of her cheeks. She also had wrinkles over her cheeks, and we combined our facelift with fractional laser, which we've talked about earlier, to reduce the wrinkling in her the center of her face.
And so where do you do that? You do that right here, right?
Yes, we have an accredited surgical outpatient facility, and we do the facelift under local anesthetic with minimal conscious sedation. People feel nothing, they remember almost nothing of the procedure, and it goes along very safely and comfortably. What we do first is we make usually a little incision under the neck. We do some liposuction if there's any fat in the neck to loosen the skin up. There's usually some muscle bands which we remove because they bring out, they make the neck sag. Then we make an incision around the perimeter of the ear, and here's, in this case, Karen's are almost invisible. We follow the perimeter of the ear around the earlobe and usually up a variable distance up the back of the ear, sometimes in the hairline. Karen didn't need it in the hairline. Her incision ends right about here. And as you can see, they are barely detectable after about 3 months. The healing time is usually quite brief. We have our sutures out in about 10 days, and they're good to go. Before then, they can present themselves in public, usually within 3 to 4 days when the swelling has reduced a bit.
Karen, tell me, when you did this a couple of months ago, what has been the reaction, and did it hurt?
No pain at all. No pain at all. I never even took a Tylenol. It was very comfortable.
And what does everyone say when they see you now?
Well, they think I lost weight is the big thing. Oh, how much have you lost? You know, so I just smile.
But everyone says you look fantastic.
Yes.
And so you're glad you did it?
Absolutely.
Wow, that's fantastic.
Absolutely.
And Dr. Fisher, let's talk about, you are having a special right now, a very, very good deal for all the women out there who've probably been thinking about it and haven't been sure. Tell us a little bit about that.
Well, sort of a depression, recession special. We're doing $39.99, just under $4,000 for a lower facelift, which includes everything that we talked about, neck, jowls, cheek, and we add on any of the other things for eyes, forehead, or fractional lasers. So it's a really reasonable price compared to what many people are charging out of it.
If you want any more information, or you'd like to look at some more before and after pictures, you can go to their website at peoriacosmeticsurgery.com, or you can call the office to get a free consultation. That's 623-876-9494.